go in for a penny, you go in for a pound, and I'm really big on industries being self-regulating, because if it's not, then you have somebody behind the desk that has probably had nothing to do with touching a plant, having an understanding. So what this deals with is, not too long ago, the USDA came out with an interim ruling that will affect every state. So irregardless of what the current state laws are, as far as hemp, whether you're a farmer, whether you're a retailer, whether you're a middleman, these significant impacts, and some of them don't make any sense at all. Example, in California, and correct me if I'm wrong, when you test for a plant being hot exceeds 0.3% THC, total THC. And that also differs from state to state as well, because some states use what's called Delta 9, which is probably more appropriate. But the point being is, an arbitrary number of 0.3% causes the plant to become hot. In some states, California as an example, it's a full plant test. In other words, we determine through a selection of one plant, is it below 0.3%? In Colorado, it's the top of the cola. In other words, the buds, the flowers, where the highest concentration of not only CBD, but THC exists. It's easier to become hot. These are some of the challenges that the USDA at this point has not entirely addressed.
Thank you. Any other comment here?
Yeah, if I could make a comment about broad spectrum versus full spectrum. Back to, I think it was Alec who mentioned it. You know, if you're in the business of selling products, manufacturing products, this is a very important thing for you to decide. We offer only broad spectrum currently products, and there's a reason for that. A couple of reasons for that, I should say. One is that where we are in Lake Placid, we have a lot of Olympic athletes, and a lot of our Olympic athletes are using our CBD products. We also have ambassadors that are professional triathletes. Now, the WADA, the World Anti-Doping Agency, is relaxing on this, and triathletes now have been given full right to be able to use broad spectrum products, non-THC. The issue, one of the issues that people face with full spectrum, as you mentioned earlier, is that you want this entourage effect of all of these different cannabinoids and terpenes and flavonoids and all these types of compounds within there. The one thing I would caution people about is that people naturally assume that a full spectrum is better than a broad spectrum, but majority of full spectrum products are nothing more than broad spectrum products clinically. Now, what do I mean by that? What I mean by that is you're taking a plant and you're making it, a quote unquote full spectrum that has less than 0.3% THC in it. Now, if you look at the COAs of the majority of these full spectrum products, they're actually much lower than that 0.3% because they don't want to trigger hot. Now, having said that, you got to say, how much THC then is that person really consuming? And is it going to, one, have any clinical significance? Right now, at these extremely, extremely low doses of THC, right now we don't have any science to say that a broad spectrum product that has 0.0003% THC in it is going to be any more beneficial than. One thing that it does is it sets you up to exposure and liability. And so it depends who your market is. If your market is athletes, you want to stay away from that. We also treat a lot of state troopers in New York State, police officers, and we need to make sure they cannot test positive. What we don't also know, besides whether or not these minute amounts of THC are actually having any therapeutic effect, we also don't know how much would you have to take of them before you trigger positive on a urine test. So even if you've got less than 0.3%, what happens if somebody drinks a whole bottle of a tincture or 20 capsules? They might test positive. So just be mindful of that.
Thank you. Great answer. Now I'm going to open this up to all of you. We have a mic runner, so if you would raise your hand if you have a question, and then wait for the mic. This gentleman in the back was first, and this lady second. How convenient. Thank you.
Cool. So 2 quick questions. CBD 101, gentlemen, you talked about the COAs. Can you talk a little bit about what to look for? I'm a little bit new to the industry. And then 2 would be, Mr. Surgeon, can you talk a little bit about the those 15? I read that FDA report about the 15 companies. I try to look at like their social media, their ads, a little bit of their website to try to like decipher why the FDA gave them the warning letters. So if you could speak to 2 of those, that would be incredible.
Want me to go first?
Yeah, go first.
I could go reverse and answer the second question. No. So basically, COA is the biggest thing. It depends on what's important to you. It's important to me and my family to eat organically and not have pesticides and all the food that we eat and consume. So you can look to make sure that it has a full test, passing all of the different mycotoxins and pesticides. Again, you're going to look to see literally one of the biggest things that people use COAs for is to see how much CBD is really in there, how many cannabinoids. I don't want to go too far, but CBD is great, but there's 113 cannabinoids in the plant, and they're all fantastic.
And terpenes.
Yeah,
And terpenes and
The
flavonoids.
terpenes are amazing.
I got to jump in on the terpenes.
Okay.
So the reason that terpenes are important is that particularly for those that have enjoyed THC for whatever the purpose is, but perhaps at some point is less interested in getting stoned and more interested in wellness. It's the terpenes that creates the flavor. It's not just terpenes that are from hemp. Terpenes are from lemons. It's what creates the flavor and the taste. When you use mech, in other words, do large quantities of CBD, in other words, a 1,000-acre crop, they can't be touched. It's got to be all done by machinery. The terpene level drops because all of the plants are competing for the same amount of nutrients, the same amount of sunlight, so therefore the CBD level is lower, the THC level is lower, so is the terpenes. If you are a believer that it's all of the plant that creates the medicinal benefit, particularly what extraction does, and this is something that needs to be shared with you, it creates a concentrate. So think about this. If I'm extracting only the best parts, obviously it's almost like a tar. This is the best way to describe it. It's brown and it's thick. At that point, even if you had a positive level of THC being 0.3 when you started, by the time that you're done with the extraction, it's now illegal to sell it as a tar because if it's elevated above that 0.3%, you then have to cut it with oils so that when you get it as a tincture, you're getting something that is permissible that can be used in your state, whatever state that you are.
Thank you.
FDA.
Yeah, so to answer the question regarding FDA, so there were, I believe, 15 letters which were submitted, and they were to some of the larger companies, players in the industry. Charlotte's Web, for example, and things like that, some of these publicly traded companies. And,
Tilray.
I'm sorry?
Tilray.
Yep. So, and basically what they were stating is a lot of the stuff that we've been saying. Some was that it was claim-related stuff. But the question really becomes is why now? Like, this is not new. People have been getting these letters for years, and we've been hearing about them. And I've been very excited because I thought within the past month we were going to get some real guidance from the government about saying what we can say and what we can't. Instead, we just got more warning letters, and that was very frustrating. So the question is, why did that happen? And there's lots of different reasons why it happened, but one of the biggest reasons it happened was regarding some of the safety concerns that have been published out there recently regarding liver toxicity in CBD. Okay, now the whole idea with liver toxicity in CBD, I have to be honest with you, I think is an absolute scam.
Correct.
And I'll tell you why for lots of reasons. First of all, the doses that people, so this came out from an animal study, came out from a rat study, okay, where they were giving rats an enormous amounts that we as humans probably wouldn't be able to physically consume, okay? Now, first of all, too much of anything will kill you. You drink too much water, you're gonna die.
LD50, yeah.
Okay, so that's one of the things. And first of all, you can't always translate animals to humans, but you definitely can't translate something that would, essentially kill an animal, at these doses and recommend that you give it to humans. No one's going to do that. I mean, these doses were doses, like I said, that we just wouldn't experience. Now, one of the reasons that study came out was because Epidiolex, which is the CBD approved, FDA pure plant-based CBD, did show some slight elevations in liver function tests. Now, how many of these were clinically significant? 1. Now, these also extremely high doses, 10 to 20 milligrams per kilogram. Okay, that is enormous amounts, of that. And the other thing is that this ties into the whole thing of drug-to-drug interactions, and so why that's one of the concerns. The issue, the problem I have with that is that as a physician, I have patients that come into my office and they're on 15, 20, 30 different medications nowadays. Polypharmacy is a huge problem in this country. And every time a doctor prescribes a medication, the last thing that they think of is they say, how is this going to interact with that drug? And how is it going to affect your liver and things like that? We just don't do that. And the reason is because it's seen as generally seen as safe.
I'm glad you brought that up because, I do liver function tests, and I have people coming to me on meds, and even though I'm going to be taking them off the meds, I do liver function tests. And why weren't these done? Anyway, that's my little rant. Thank you. We have, 2 more minutes, and this lady here had a question? Yeah, you had a question. We need to get you right.
Adam, Dr. Abadili. Adam.
Can you wait just a second for the mic's coming your way? And hold it close.
So my question is, it's quite obvious why you would want to stick with the broad spectrum, given your client population and that people don't want to potentially risk testing positive. But what, in your experience, and maybe this isn't something you've studied, but I've heard and experienced myself that there are enhanced benefits when you have CBD in conjunction with THC, low quantities of THC, certainly above the 0.03%. So that being said, are there being current studies done on people just growing, not just the industrial hemp, but cannabis plants that have a very low percentage of THC and high CBD that aren't industrial hemp but have enough THC to be beneficial? And if so, what are the enhanced benefits that you've seen from the additional low amounts of THC but enough to be significant?
Yeah, so there's no doubt THC is a huge player in the therapeutic effects of cannabis. No doubt, hands out. It's indisputable. We have more data on that right now than we have on CBD. The question is the way I look at it is that in addition to the CBD side of things, I also have a medical cannabis practice where we have over 2,000 patients, 6,000 visits of people who are there to get medical cannabis, meaning THC, high THC products. We start these people out on doses of somewhere between 1 to 5 milligrams per dose. So if and that's what we've known in studies have been shown to be potentially therapeutic. So when somebody takes let's just use the example of a soft gel, and it's got 0.00 whatever percentage of THC in it, well, how much of that are you going to have to take to get to 1 to 2 to 3 to 5 milligrams of THC in order to have a true, at least what we know clinically is having a therapeutic effect? There's no doubt that full spectrum products are better than isolates in my mind. Well, I shouldn't say that. The studies show that. But how much is THC really contributing to that? We don't know. But we do know that what we can say is that in order to have a therapeutic value for particular disease ailments, we know that there are concentrations that are higher than that. We're treating people with conditions. We're sometimes giving people 25 to 30 milligrams of THC a day, right, to treat their condition. You're not going to get anywhere near that. So I think that with a full spectrum product, you know, it's a lot with that minuscule amount of THC in there, it's probably a lot more beneficial for general endocannabinoid health. So like if, you know, there's different reasons people take cannabis. Some, you know, or CBD products. Some people do it for just health and wellness as a supplement. That's what I do, okay? But if I was treating an ailment, I would want something that has higher concentrations of a lot of these things, particularly like THC. But so right now, if people are trying to treat an ailment per se, I can't say that there is any science to support that a full spectrum that has a minuscule amount of THC is going to be any better than a broad spectrum with no THC. There might be a little bit, but can't do that, and then it just becomes your ability to have risk, you know, your risk exposure. You're willing to take risk exposure with your clients.
Thank you. And I wanted to add something, and that is that when you read the research, and I've been reading a lot of research lately because I'm doing presentations and formulating, and what you'll notice is very high doses of CBD. They say you can go up to 1,500 milligrams. Well, they're talking about isolate, where you have to go up to high dose. You have to get high doses because it doesn't have the entourage effect. So then you may have a higher risk if it ever caused any sort of liver congestion even. You're really taxing the liver when you're going into those high doses, and the kids on Epidiolex are also still on their seizure meds for the most part. So that's a big load for the liver.
Yeah, and the other thing too about the isolates is that we have to be careful about is that you know, right now pure CBD isolate is defined as a drug because of Epidiolex. Okay, so this is the problem we're having right now. If people are using isolates, they're now fighting the FDA. And I was recently at the International Society of Cannabinoid Research Society, international meetings, looking at what all the drug companies are studying, where they're going with this. And the one things that they're focusing on are isolates and synthetic molecules of isolates. So eventually they might say, you know what, you can't use isolate. So we don't know if we're there yet. Now, for most companies that are manufacturers of this stuff, it's going to be probably pretty easy for them to pivot from making an isolate to going back to either using, you know, crude or broad spectrum distillates, full spectrum distillates. But it's just something that the industry has to be very mindful of with working with isolates, because I do believe that the isolates are ultimately going to end up in the hands of pharma.
Yeah, and GW Pharma owns the patent, obviously, on CBD. So here in California, I'm on the California Hemp Council as well. If you guys were hearing of stories of California ripping CBD products off the shelves of Lawson's and other places, it's because, and this is inside knowledge, it's because that GW Pharma is actually using the arm of the government to see if they could actually do a recall based on that particular patent. So if you had CBD on your bottle, that's why they took it off. And if they saw your COA was an isolate, they were like, ooh, let's see if we can just get the FDA and California Public Health to do a little of our, busy work for us. So again, eventually, like you said, you're gonna, run into some trouble with CBD isolates because that's a pharmaceutical patent. If you can't patent a plant.
We're actually a little bit over, but it's lunch now. Would anybody want to go another 5 minutes or so? Yeah. Sure. Yeah. And if you need to leave, you can. There's a question over here. If you can.
I have a question related to the gentleman's question back there in terms of, evaluating a COA.
Would you wait for the mic?
Sure.
It's almost at you.
He's loud enough.
I can project.
All of the mic.
My question is related to the question the gentleman asked earlier regarding, looking at a COA, how do you evaluate it? You mentioned something earlier about, 0.3% or below being sort of below what you would consider sort of a clinical significance. So, once you've evaluated a COA and determined that it's not contaminated, doesn't have any heavy metals, and you're looking at all of the different cannabinoids and terpenes that have been measured for, and obviously you can only evaluate what you measure. Most of the cannabinoids and terpenes content are going to be in very, very trace amounts. At what point do you start to consider the value of that particular constituent? In other words, if the content is greater than, 1%, would you consider that to be sort of a clinically significant constituent that you could consider in the context of formulation or therapeutic application?
It's a great question. May I unpack that question a little bit?
Absolutely. It was follow your question, take it where you like to go.
So we're only talking about hemp for the purpose of the response to your question. We recognize that there are different strains, and depending on the strain of hemp that you're growing, you will find everything from non-detectable, which doesn't mean it's not there. It's just based on the existing lab's methodology, they cannot find any presence of that particular, say, cannabinoid. However, you can grow, for example, a certain strain that is very high in CBG and almost no CBD. You can grow certain strains that have 1% or even 2% of CBD and CBN, CBG and CBN, and say somewhere around 12 to 15% CBD and still not go hot on the THC levels. For those individuals that are a little bit wonky about the product, in other words, the more, the level of the various cannabinoids, the better. I personally prefer that, but I can't render scientific information to suggest that my decision matrix is the only one that's out there. The one thing I do want to say is the United States is pretty far behind other countries, using Israel and China as the example, as amount of research that has been done on hemp. So the information is out there, but we're kind of strange as a nation. We got to start from scratch as opposed to looking at some of the scientific studies that are all double-blind studies. We got to start from the beginning, and that's unfortunate the way that we do things in the States. I believe that the gentleman, the doctor
Yeah.
to the right, might have some
Yeah,
opinions
to answer
there.
your question, in my mind, it's a lot less about the percentage because we don't, as physicians, we don't talk about percentages. We talk about milligrams,
Yes.
Going into our body, right? So, I just did some, very brief calculations here, but if you were to take 25 milligram cap, like let's say someone says there's 25 milligrams in it, and of that, you've got something that's 0.3%. You're getting 0.075 milligrams of THC. And I 0.075. And what I told you before is that we typically start dosing people anywhere from 1 to 10 milligrams. So you're talking a matter of 1,000th of the doses that we typically do. Now the question is that 1,000th of a dose contributing to any positive effect? That we don't know. But at the same time, it doesn't mean you're not exposing yourself to potential positive THC tests. But at the same time, to his point, a non-detectable also doesn't necessarily mean it doesn't have any THC in it, because it all depends what they set their benchmark is as being non-detectable. If theirs is like almost close to 0, that's a lot more reliable than if they say our non-detectable is 0.1%, right? So you have to look at the labs and you have to say, what is their criteria? And are they using really strict criteria? You want someone that's looking for the lowest concentration possible.
Thank you. And another thought about that is in the extraction, when you're going from broad spectrum, from full spectrum to, I'm even confused now. The
Yeah.
full spectrum is one with a bit of THC. If you just leave it intact and you don't take out that last little minuscule amount, you're actually saving an entire process of extraction, which
Pretty expensive.
it's hard to believe that it can single out just the THC. Maybe you can, but you're already processing it a little more. So to that, I mean, I've always had mine as the THC free, but I'm also looking at this other aspect.
Yeah, and it's important. It's just a matter of what is the clinical significance of that, and then what is the risk exposure to that.
Right.
So that's something that companies need to individually decide themselves. About the risk exposure, the science, we still have to learn.
Who's got a mic? I see lunch over here. She wants us out of here. All right.
Okay.
Thank you.
Thank you. By the way, everything, our bios and our contact information are all in the program. And thank you very much for being such a wonderful audience.
This